In clinical research, selecting the right data collection approach is crucial for ensuring the quality, accuracy, and efficiency of the study. This section will guide you through the key factors to consider when planning your data collection strategy, including the type of data you're working with, the collection method, and whether you're using pre-existing data or collecting new data. Each of these aspects influences how the data is gathered, managed, and analyzed, ultimately impacting the integrity of your research. Understanding data types and formats. The first step in developing an effective data collection plan is understanding the structure and format of the data you intend to collect. The way data is structured determines how it should be captured, stored, and analyzed. Structured data. This refers to data that follows a predefined format, such as numbers, dates, or categories. Examples in clinical research include standardized forms used to capture patient information or study parameters. Structured data is easier to manage because it fits into a consistent format, making it simple to analyze and interpret. Complex machine-generated data. Some types of data, such as medical imaging like X-rays or MRIs, or biometric measurements like ECG or EEG, are generated by specialized medical equipment. These data are typically stored in digital formats and may be large or complex. Proper management of this type of data involves linking it to the study database, along with relevant annotations to ensure accurate analysis. Unstructured data. Not all data fits neatly into predefined categories. Clinical research often involves unstructured data, such as interview transcripts, observational notes, or open-ended survey responses. This type of data is typically recorded in free text format and requires additional processing. Coding methods, such as thematic analysis, can be used to categorize and structure the data, enabling easier analysis and interpretation. Data collection location and approach. Once you've determined the type of data you will be collecting, the next key decision is where and how the data will be gathered. Will it be done in person, remotely, or a combination of both? The method chosen will influence the tools and techniques you use, as well as the logistics of your study. In-person data collection. When data is collected face-to-face, such as during study visits or clinical appointments, the design of data collection tools must account for the interaction between research staff and participants. If the participants are filling out forms themselves, the forms should be user-friendly and easy to navigate. If research staff are entering data on behalf of participants, more complex data entry may be required, but research personnel can be trained to ensure consistency and accuracy. Remote data collection. Remote data collection is increasingly common, particularly in longitudinal studies or when involving participants from diverse geographic locations. Methods for remote data collection can include digital forms, online surveys, or automated systems. In some cases, participants may fill out paper-based surveys that are later scanned or digitized. For those without internet access, mobile options like text message surveys or automated voice response systems can be effective. Regardless of the method, it's essential to ensure that the process is secure, especially if handling sensitive health information. Data security is paramount, particularly when collecting remotely. Ensure that your collection methods adhere to privacy regulations and that data is securely stored and transmitted. Existing data versus new data collection. An important consideration is whether you're working with pre-existing data or gathering entirely new data for your study. Each option has its advantages and challenges. Using existing data. Many studies rely on data already collected through previous research or from healthcare systems. This may include data from patient records, prior clinical trials, or publicly available data sets. The key challenge here is data extraction, particularly if the data is unstructured, such as physician notes or clinical narratives. Advanced techniques, including natural language processing, can be used to automate the extraction of structured data from these unstructured sources. Collecting new data. When gathering new data, you have full control over the collection process. But this also comes with added responsibilities. You must design a data collection process that aligns with your research objectives, ensures quality control, and meets regulatory standards. New data collection can be more resource intensive, but it allows you to tailor the data exactly to your study's needs. Key considerations and takeaways. To summarize, when developing a data collection strategy for clinical research, consider the following. Data type and structure. The nature of the data, whether structured, machine-generated, or unstructured, will influence how it is collected, stored, analyzed. Collection method. Whether you collect data in person or remotely will determine the design of your tools, how data is entered, and the security measures required to protect sensitive information. Existing versus new data. If using existing data, the focus will be on extraction and ensuring the data meets your study's needs. If collecting new data, ensure your approach is aligned with the research goals, efficient, and compliant with regulatory requirements. By carefully considering these factors, you can develop a robust data collection plan that supports the success of your clinical research study, ensuring the data is accurate, reliable, and useful for your objectives.